Today, we are sitting down with the new Mexico Breastfeeding Task Force. This is an organization that provides an immense amount of care and support for breastfeeding moms, organizing breastfeeding support groups, also helping companies to establish lactation-friendly work environment. They are helping hospitals to line up with the baby-friendly initiative and also provide scholarship for individuals who would like to become certified lactation counselors. My guests today are Executive Director Monica Esparza and Core Team Leader Siboney Rodriguez. We will talk about all the work that they have done in the last few years and what their plans are for the future. We also talk about the upcoming annual conference that is in March and is now open for registration if you would like to follow the link in the description. Just a disclaimer that at one point we are interrupted by my 3-year-old son, who thinks it is time that he has his say on the podcast too. So don't forget to like and subscribe, hit the bell for notifications, and now enjoy the talk. I'm here today with Siboney Rodriguez and Monica Esparza from the New Mexico Breastfeeding Task Force. Thank you so much for joining me.
Thank you for having us.
Your vision is a world without barriers to lactation. What do you see at the moment as the main barriers to lactation?
So I'll go first. This is Monica. I see access as one of the main barriers, especially here in New Mexico. Access to lactation care providers, whether it's because of Medicaid coverage or insurance coverage or rural communities and the lack of providers in rural communities, or just the access to for folks who are wanting to pursue lactation education and become a provider. Access seems to be one of the biggest barriers. There's just not enough lactation care providers in the communities, especially in rural communities. There's not enough lactation care providers that speak a different language beyond English. There's not enough lactation care providers overall, and the ones that do exist, also have to make a living. So our families, especially here in New Mexico, who 80% of families qualify for Medicaid, they're not able to pay out of pocket. And the coverage that exists, especially for Medicaid, is little to non-existent. So families have to rely on the little amount of providers that are either networked or work within the hospital systems, and it's just not enough. Siboney, would you like to add anything else to that?
I do, Monica. I agree. I think access in New Mexico and beyond is a big deal. Whether it be in the community that the families live in the language that they speak, that's culturally congruent. But I also think that there's a lot of misconceptions about human milk feeding, and I think that communities and society are kind of struggling to support the lactating families, right? So whether it's like interpersonal support, familial support, or even workplace support, right? When families have to return to work, how do they continue their lactation journeys? And I think just overall education, both for professionals to have that education to provide the support, and for families to be knowledgeable around human milk feeding and the benefits to, baby, mom, the environment. I think that we're kind of working on closing that gap and creating human milk as the first food again.
Right. I see how you define access as the main issue that totally lines up with the strategic goals that you have defined to reach by the end of 2024, to increase lactation support in healthcare, to build the lactation professionals pipeline, promote community and family support for lactation. Why did you choose these specific focuses, and how far did you come in achieving them?
Well, we see the world through a lactation ecosystem. So every one of us is part of the system as a whole that supports the family diet. And when we look at it that way, we see these three different buckets or arms or spaces where the priority needs to happen because of the inability for families to access lactation care. We see where families will get their prenatal care, will birth, and then will continue to get their care in healthcare systems. They need to have access to providers that not only are supportive of lactation, but they also have the knowledge and to know the basics, to be able to provide that education, that support, and to know when and where to refer to. So that's where we see the lactation support in the healthcare system. We are excited that in New Mexico, one of our programs is to support hospitals to become baby friendly. And I'll let Siboney talk a little bit more about that. But one of the pieces is that we do have 17 hospitals that are baby friendly. But even that, within that system, so we're excited about that piece. But we also know that we have 12 other hospitals that are not on the that are not baby friendly. And so how do we support those hospitals who are not and can't be at the moment to take steps to move forward in and implementing policies or implementing guidelines and systems that can support families. So we're excited at the progress we've done. We know that we need to help those hospitals that have designation maintain designation, and then help those hospitals that do not have designation, are not on the pathway, and perhaps may not be in the pathway for a while. What are some steps that they can take towards that system of support? With the lactation professional pipeline, we know here in New Mexico, the majority of families, 45% of families identify as Hispanic or Latinx. Um, there is a big portion of families that are self-identify as Black, Indigenous, or people of color. And we know that families tend to feel more comfortable when they're supported by someone who looks like them, someone who speaks their language, someone who comes from their cultural background. And so one of the pieces that we want to do is we want to expand the lactation care providers that are in place. We're doing that by building scholarships. We are excited to have awarded this past year 26 scholarships for people who wanted to become certified lactation counselors to be able to take that training. Because we know one of the gaps is access to lactation education, whether it's financial. There's also the time piece of it. Families are busy. So that's one of the steps that we're taking forward is increasing the lactation care providers that exist in the community. There's more need beyond that. So expanding it for people who want to take that next leap and become lactation consultants or sit for the IBCLC exam. We're still working through that process of what that's going to look like in New Mexico. How do we support folks who want to take that steps? What are some mentorship programs that we can establish? So we're not there yet, but we have definitely taken a big leap at building some of those steps that need so that we do grow within our communities. We grow our own lactation consultants, also understanding that not everybody wants to be a lactation consultant and not everybody needs a lactation consultant. So supporting those other pieces in place, like through the scholarship program. And the final one, COVID impacted us just like it impacted so many communities. It impacted families, and the task force has a local chapters that work within the communities that are on a volunteer basis. They volunteer their time to grow, to understand their communities, to understand what the community needs, and build on that. People were stretched thin and people had other priorities, and so our chapters were not as vibrant or as thriving as in the past years. But this past year we were able to support the volunteers, the community leaders who wanted to establish a chapter, to get that reinstated, reestablished, or even just strengthened. And now we have 12 active chapters across the state. And they create awareness within their own communities. They understand the needs of their own communities. And they're able to provide us that feedback because they're voice boots on the ground, right? They live there, they work there, they have their families there, they know those needs. They're able to provide that information to us on a statewide level so that our messaging is what the community is waiting to hear, so that our priorities or our focus is where it needs to be. Um, and continuing to implement that on some of the pieces that in the past we haven't been as strong. For example, our outreach to fathers and messaging around fathers and father inclusion and that lactation education and that lactation support. Also, our reach our inclusion, making sure that our message is inclusive of all peoples. So, working with our LGBTQIA plus community and learning from them and hearing from them what they want to hear as messaging. So, we're really excited about those pieces being implemented this past year. Anything else that I missed, Siboney?
No, I think our goals, moving forward, and even, looking back at last year, we wanted to take the silos out, right? We wanted to remove, this island of lactation, and really view families as people-centered, community-driven, right? Our families have the answers to what they need. And like Monica mentioned, we're kind of tapping into all aspects of this ecosystem, through our work with hospitals and clinics, by creating lactation professionals in these communities, and by tapping into our chapters that really can hear the answers that we're looking for, right? We are not always the experts, right? Our families are the experts on what they need and how they want to be successful in their infant feeding journeys. And so I think that I'm really proud of the work we've done in the last year, and I look forward to the next year of kind of closing those gaps, removing those barriers, and kind of remaining off our island and really just kind of in our communities as they are.
That sounds fantastic. How much do you think the breastfeeding rates have changed in New Mexico based on the work that you have done?
Um, I think we are at a place where it's it has increased. Our initiation rates have increased. There is this general understanding of human milk being the ultimate food source for infants. However, normalizing the needs that families have, I think that's where we're still are working to grow, to continue to develop that support system, because everybody knows that breastfeeding, chest feeding is good for babies. But as Siboney mentioned earlier, that piece of all the pieces that go into supporting a family so that they're supported, so that they're able to achieve those goals, we're still working through that. So, lactation support in the workplace, in the community with their providers, all those pieces are impacting our duration. And so right now, that's one of the pieces that we're really focusing on, is ensuring that families have those systems in place, so that they're able to achieve their own breastfeeding or chest feeding goals and go through that duration. So we're excited at the steps we're taking forward, and the increasing in initiation. But we really want to focus now on closing the gap, as Siboney mentioned, and that duration. Siboney, anything else you'd like to add?
Yeah, I think New Mexico has come a long way. We actually, for many years, we've been able to exceed kind of the World Health Organization goals for lactation. We've been able to exceed some of the national standards that have been set as well. And I think a lot of that has to do with the work that we're doing to increase breastfeeding initiation. And like Monica mentioned, for duration, like much of the country and the world, where we are seeing a drop, once families leave the hospital system, when they don't have access to that support, or when there are workplace policies that aren't supportive of lactation continuing, or that familial support, right? So it's called kind of multi-layered, right? We want to look at it from a systems level, and do we have policies in place in government and in states to protect lactating families to continue their lactation journeys? And then it trickles all the way down into where the family lives, where they work, where they're having their babies, right? So where you have your baby matters, because it's going to change what support you have available.
Yeah, yeah. And as you mentioned, I think this is a two-way kind of road. One of them is going from the police perspective that we do need supportive policies in place. And from the other direction is that it's all coming from the family and the immediate surrounding of the mom and the support there. You mentioned that more and more businesses start to recognize the cost saving aspect of having a good lactation support program in place and how it increases the productivity of employees. You provide help for businesses to create a lactation-friendly work environment, and I was wondering, what sort of help do businesses need? What do they look for when they come to you?
Honestly, a lot of the businesses just want more clarification. I think when they see the law, when they see here in New Mexico is an employer has to provide an employee with a clean and private place and flexible workplace. Right away, all these alarms go off, right? Like, oh, do I have to build a new place? Do I have to build a lactation space or a new room? Where is that? If we're already short staffed, how is that going to look like? So just a lot of the businesses just need that little clarification, that brainstorming session, and it's really what we do with them. We brainstorm with them where they can identify that space for families to use to pump. How, we go from a very small space to, like, if they have the funding and the means to create a designated just for lactate pumping only place, we go grand, right? So a little bit of that, calming them down and helping them understand that it really can fit their needs and what they are able to provide. The ultimately is just making sure that they provide that.
Do you see increased willingness from companies, workplaces to implement lactation support?
Absolutely. I believe that everybody wants to do the right thing. Mostly everybody wants to do the right thing. And it's just that nervousness about how to do it. COVID, of course, has impacted that as well. And people being short staffed, right? So even though businesses want to do the right thing, they're just nervous about how to do it and what that's going to cost them, because now business are stretched thin too. So it's really walking them through that process from a partner perspective, letting them know that we're not, even though our name says task force, we're not the breastfeeding, chest feeding police. We really come in as a partner, and the benefit that they get from it. And now that a lot of more businesses are understanding the benefit, then they do see how these pieces fit into their policies. And some of them really get excited about being able to do that. We do have some work to do with, like, some of the franchises, or the businesses that are for low income business communities. And so it's just kind of spreading the word and trying to help all people and all businesses understand that it's not a big ask and it's not super difficult to do.
I think one of the things that we've been able to do here in New Mexico is build partnerships and relationships with all different sizes of organization and businesses, right? So we work with employers that employ one or two people, and we work with big city entities that have multiple offices and branches and thousands of employees. And through these relationships, we're able to learn, right? We learn from them, and we are able to develop creative solutions to help ensure that families are able to have the time and the space to pump for their babies. And the other thing that we've done is partner with other organizations that are trying to promote family-friendly workplace environments, right? And through these collaborations, we're able to be successful in kind of identifying space, identifying time, really kind of easing those nerves, like Monica mentioned. It isn't a negative thing when we come in to support, right? We're walking alongside these businesses. And what we're seeing is that we're not only being contacted by employees, but now we're also being sought out by employers to provide education and training and solutions. From ski resorts to restaurants, city employees, we're kind of all over the map. We were recently able to participate in the Albuquerque International Balloon Fiesta and provide a space for visitors and staff to feed their babies. And so we're kind of just pushing the boundaries a little bit, and it's been a really great thing.
I just have to announce something. My little boy woke up, and he's just right here with me, my 3-year-old.
Hello, baby.
Can I ask one more thing from the ladies? Yeah. Okay. So your annual conference is coming up in March this year, and we're focused on building this a reliable lactation ecosystem that we talked about. Can you tell us a little bit more about the conference itself and what people can expect?
I think this will be the 27th annual conference. So the task force has built a long-standing reputation of having an amazing conference, right? Of people being able to connect. It has been a little difficult in this past few years that's been virtual, but we still have figured out and brainstormed and figured out a way to help community connect. That's one of the pieces of going to a conference. It's not just the information that you get, but also the connections that you can get from each other, and the knowing other lactation advocates and colleagues that you can possibly call on or brainstorm, knowing about other resources in the state and across the state. So that's one of the big pieces of it. We really have worked intensely and intentional to ensure that the conference comes with an equity lens embedded into every single piece of it. It's not just like a checkbox that we say this is the equity session, or rather we ensure that all of our speakers, all of our content comes from that perspective of supporting and uplifting the voices of those most impacted by racism, by disparities. How do we all address that in every piece of the conversation, and how do we keep that going as a part of the conversation? And so that's one of the things that attendees really do appreciate, is not only do they take the knowledge and content of it, but also the added piece of always having that conversation of equity and what that means within the lactation system. It's also I MC the conference, so I always pride myself in looking at it as going to an educational event, but also feels kind of like sitting on your best friend's couch and having a cup of coffee. Like, it's a little bit of both. You're learning, but you're also in this really comfortable, laid back space where you're able to ask your questions and really think deeply about the pieces that are important to you. That's my take on it, but I'm biased. Anything else you'd like to add, Siboney?
No, Monica, I think that we've built a really strong community of people who attend our conferences every single year, whether they were virtual or hybrid or in person. A lot of our folks and our attendees, they really look forward to the networking opportunities that come with it. Of course, we do try to cultivate topics that are centered and focused and inclusive. Really looking at what clinical pieces need to be addressed, while also understanding, again, that this is so much more than lactation, right? When we're addressing familial care and wellness. And so our conference really does come from that lens. And I think that this next year will be amazing, because we are hoping to offer an in-person option to kind of give back some of those hugs and those warm feelings and that cup of coffee along the way. So I'm really looking forward to it.
Well, that sounds absolutely wonderful. I love the community aspect of the conference. It really brings the people together, which is already the part of the lactation ecosystem. So thank you very much for your time. It was wonderful to hear about your work in detail. And I make sure to include the link to your conference in the description. Thank you so much.
Thank you, Eva. We appreciate you.
Thank you so much for having us and for reaching out. It was really a pleasure to have these conversations with you.
Next time, we will talk about our frenemies, the breast pumps. These are must-have devices if you need to return to work and would like to maintain your milk supply. But the issues of discomfort and inefficiency are never far behind when it comes to these devices. So the question is, Could breast pumps do more for us? Is there room for improvement?